Hello, we are delighted to share with you the ways our patient movement quality improvement project using Insight has changed patient and staff experience of the service and has contributed to the development of a patient engagement and experience quality improvement strategy by the Trust, strengthening our foundations for establishing partnership working and co-production as standard practice. My name is Sandra and I've been the improvement lead for this project. Presenting with me is Donna, the SRO, and our head of estates.
So Nottingham University Hospitals is a large teaching trust, and relatively little was known about the patient movement service. But following some early discovery, we found we had around 7,000 to 8,000 ward-to-ward transfers and 20,000 to 28,000 radiology inpatient movement jobs per month, some of those with inbuilt complexities. The Trust had no visualisation of this, and following an uncomplimentary external review and internal feedback resulting from clinical staff moving patients, delays with transfers as there was an unmet demand, and this had a marginal confidence factor in the services that we were delivering. We recognised this and built our QR project to supporting improvement patient flows and stays, and this took a trust-wide approach with patient experience at its centre and aimed to support the Trust with visibility and oversight of the patient movement process with clear KPIs and standardised processes to be empowered to monitor and address delays in patient flow. We'll now share with you 3 reasons why we believe using staff and patient insight, our project has strengthened the improvements of patient carer staff experience within our organisation with a positive impact on patient flow. We initiated a trust-wide change programme using the quality improvement methodology, creating a staff and patient collaboration that enabled us to see and sustain our improvements.
This initiative was driven through the Trust Tier 1 Quality Improvement Programme, improving inpatient stays. Delays in moving patients once fit for transfer are cited as contributing factors for patients waiting and being delayed for investigations. Possible patient harm and bed days lost due to reserved beds awaiting patient transfer were consequences of such delays. Owing to the impact of this on patient dignity, experience and safety, this had to be an ambitious programme. It required a whole trust, large-scale change programme with improvement methodology at its heart. So we needed to be innovative, and our approach was to do this through collaboration. This enabled our work to be locally led, insight-driven, with staff and patient feedback and involvement. Hence, patient and public involvement was established in this work at the very start, and we embraced experience-based co-design with our staff and patient partners. High energy came from our staff as we facilitated them to make small changes locally to see the impact of these and showcase their successes. Our primary concern was to inspire a shared vision for this work, to enable others to act through a supportive and an enabling culture from board to ward. The leadership showing in this programme governance slide is indicative of the supportive framework we built. We made this everybody's business to facilitate a sustainable impact of our collaborative efforts. We didn't want to become one of the 70% failed projects, and we believe by using our improvement methodology with insight, we succeeded. It's worth just saying we also gained a national commendation from the President of the Royal Statistical Society in the recent Florence Nightingale Awards, and we're really proud of that. Our qualitative research was taken from multiple sources, local and national surveys and reports. We reviewed these in detail and aligned the sentiments to 3 common themes, then related these to how the patient movement project could support. In summary, the feedback told us that we had many delayed discharges, high frustration, but also a strong desire to improve was the message we got from staff. And from a patient experience perspective, we had too many examples of delays and patients waiting. Our response to this was to support timely patient movement and transfers to the discharge lounge. We also supported patient movement to the base wards and to diagnostics through a rapid improvement approach, and found that by doing this, we released around 15 whole-time equivalent ward staff time to care. We then looked to build our patient movement dashboard to be able to see our lead and cycle times to enable the insight to design out waste. Our work was aligned to the trust objectives and quality priorities. Staff and patient insight, involvement and empowerment is something that we're really proud of. This was one of the first times this approach was trialled at large scale, with sustained positive impact on better staff and patient experiences. We believe we have captured hearts and minds as we've focused on designing experiences, not just processes and systems.
This project was led by members from all divisions with staff representing each clinical specialty. All stakeholders were involved in the development and delivery of our PDSAs and engaged in the sustainability of the improvements. The feedback that we've seen over the improvements from all of those involved has been fantastic, and seeing how this has impacted on patients and how nursing teams have more time to care is our driver for continued improvements. The dashboard provides visualization of jobs logged amongst a number of other themes, completed jobs and the average allocation time. The number of delays will help us to identify where further improvements can be found, and this is our focus at the moment. So we need to understand the reason for the delays and how we can design them out of the process to improve efficiency. Our data shows an improved position of visualisation of the whole trust on Nerve Centre and how we are performing against our KPIs. We have consistently demonstrated a reduction in the total trip time of around 50 minutes, and nearly 64% of all jobs are allocated within 10 minutes. We also track radiology separately as they are our biggest users of our services. And as a result of the improvements, their vet to scan time was reduced and over 40 hours of extra scanning time was seen. This has resulted in an extra 120 scans per week. The value in money terms sits around 700,000. The reduced wasted time to patients, delayed discharges and delay-related harm is priceless. Our work here is not done. Through the sustainability planning and ongoing trust-wide engagement, the changes we initiated continue to show a positive impact. Our future ambitions for improvement will be guided by the Emergency Task Force, comprising of representatives from all clinical divisions, and we continue to engage with our patient partnership group. We continue to plan our next steps, recognising that efficient patient movement supports better staff and patient experiences. As a project and as a trust, we have experienced the positive impact of patient and carer representation. This insight helped ensure we had a shared understanding of the needs of our community and that these needs were met in a compassionate, informative and accessible way. This positive collaboration between patients, carers and staff has contributed to the development of a patient engagement and experience strategy by the Trust, strengthening our foundations for establishing partnership working and co-production as standard practice. Thank you for allowing us this time to share our project with you, and would welcome any questions.